Are we ready to loosen COVID-19 restrictions? That is the question being asked around the United States today. The COVID-19 pandemic has been a global struggle for over 3 years now. Yet, with the tireless efforts of scientists and health professionals, we've begun to see a glimmer of hope. Vaccinations are being rolled out at an accelerated pace, with predictions that most Americans could be vaccinated by the end of the summer. However, it's not all smooth sailing. The emergence of new variants poses a potential speed bump on our road to recovery. Cases of variants from the UK, South Africa, and Brazil have been reported across the country, raising concerns among experts. Despite these challenges, some states are taking bold steps towards a semblance of normalcy. They're considering loosening their COVID-19 restrictions, sparking a heated debate on the timing and safety of such decisions. As we delve into this debate, let's begin by looking at the states that are leading the charge in loosening restrictions. Several states are at the forefront of easing COVID-19 restrictions. Let's take a closer look. Texas, New Jersey, and Pennsylvania are among those leading the charge in loosening their guidelines. Their reasons for this shift are multifaceted, with vaccination progress and economic considerations playing significant roles. In Texas, the push for reopening is underpinned by the state's ongoing vaccination efforts. Their goal is to have a vaccine supply for 300 million Americans by the end of July. With more pharmacies starting to provide vaccines by appointment, there's a hopeful projection that pharmacies could administer 100 million doses per month. New Jersey and Pennsylvania, on the other hand, are primarily motivated by economic factors. They've increased capacity for restaurants and businesses, with Pennsylvania even allowing indoor concert venues and arenas to operate at 15% capacity. These decisions are meant to kickstart their economies, which have taken a significant hit due to the pandemic. However, it's worth noting that these states are also contending with the spread of the more infectious B.1.7 variant. This raises the question of whether the loosening of restrictions may be premature. While these states are eager to return to normalcy, not everyone agrees with their approach. Contrary to the aforementioned states, there are voices of concern emerging, questioning the timing of these changes. Experts and opposition groups are cautioning against hasty action, citing fears about new variants and the potential for a fourth surge in cases. The director of the Centers for Disease Control and Prevention, Rochelle Walensky, has warned of impending doom despite a growing percentage of the population being vaccinated. The average daily case numbers have seen an upward trend in more than 30 U.S. states. Hospitalizations have also seen a rise, increasing by 5% on average over the past 2 weeks. States experiencing surges share certain commonalities. Some have loosened restrictions too quickly, while others are grappling with the spread of more infectious variants. In Florida, for instance, there has been an 8% increase in cases in the last 2 weeks, with the highest number of B.1.7 cases and the highest proportion of cases linked to the variant. Other states like New Jersey and New York have increased capacity for restaurants and businesses, while concurrently experiencing a spike in cases. This has led to apprehension about the premature easing of restrictions. Texas, New Jersey, and Pennsylvania are among the states seeing surges coinciding with recent reopenings and relaxed restrictions. This has sparked concern among some residents and experts who fear that the health systems in these states could be overwhelmed if the situation escalates. As we can see, the decision to loosen restrictions is multifaceted and not without controversy. So, where does this leave us in the debate over loosening COVID-19 restrictions? We've heard the arguments from both sides. On one hand, there are states that are eager to ease restrictions, aiming to kickstart economic recovery and restore some semblance of normalcy. These include states like Texas, New Jersey, and Pennsylvania. On the other hand, we have the concerns of health experts cautioning against moving too quickly. The fear is that this could lead to a resurgence in cases fueled by new, potentially more contagious variants of the virus. In this complex scenario, it's clear that each decision carries its own set of risks and rewards. The loosening of guidelines could indeed be a much-needed respite for businesses and individuals alike. However, the potential for a surge in cases, driven by new variants, remains a significant worry. It's a delicate balance, with the health of millions hanging in the balance. The situation is fluid, and the debate is likely to continue as we navigate our way through this pandemic. As the situation continues to evolve, the balance between managing public health and returning to normalcy remains a challenging and contentious issue. Stay safe and stay informed.